What if I told you that your hips are tight because of your emotions? You might think I'm crazy, but you will see that there is actually a huge connection between our emotions, well-being, and those chronically tight spots in your hips. And that is the reason hip openers are great for unleashing trapped energy in and around the sacral chakra. It is very common in today's busy and demanding life to get tight hips from all that sitting and then rushing around from here to there. We are often just moving our hips in only one way, all day, every day, forward and back. Our hips are the biggest, most powerful joint in the body. Hip openers can have a lot of sensation as we stretch and release our hips. It can help us to let go of stiff and rigid beliefs in our minds and allow our creativity to flow. This gives us more ability to feel alive, present, and joyful. Namaste friends. I am Ritesh and today we are covering the second part of hip alignment. So, if you have missed the first part, please check it out. The link is given above. Let's get into the history a bit to understand about hip alignment. Before the 1980s, no one really bothered about tuck your tailbone under, or in other terms, a posterior pelvic tilt or an anterior pelvic tilt. But by the 1990s, as yoga teacher training started certifying students in bulk, a common cue that asks students to tuck their tail in a variety of standing postures, such as the warrior poses, mountain pose, chair pose, and even triangle pose. A slight pelvic tuck, also called a posterior tilt, can help to elongate the spine. Various ways to ask for tailbone tuck arose. Students were told to scoop their tail, drop your sacrum, or draw your belly to your spine and move the top of the hip backward. Why? Because first of all, most of the students have a common anterior pelvic tilt. So too many students were sticking their tails out in these standing postures. And when a student sticks their tail out, that is anteriorly tilting the pelvis, they create too much lordotic, that is a backward curve in the lumbar spine, which can overstress the joints. Friends, in the yoga industry, there are a lot of fixed alignment patterns, and one of them is tuck your tailbone under. And some yoga teachers or practitioners blindly follow this. As I have told you earlier in my alignment videos, there is never a black and white answer. Bear in mind that between black and white exists the full spectrum of colors. This, of course, makes yoga teaching more challenging as we need to cue from what's in front of us rather than using one size fits all cueing. Let us take an example of UTKATASANA, that is a chair pose, or also known as awkward pose. Chair pose, that is UTKATASANA, with a pronounced anterior pelvic tilt, and other one that is with a posterior tilt, also called a pelvic tuck. Notice the effect on the spine in each variation. An anterior tilt deepens the lordotic curve of the lumbar spine, while a posterior tilt reduces the lordosis. So friends, here I have the first student with anterior tilt. Here, if I ask him to do a posterior pelvic tilt, he can benefit by engaging the core, stretching the hip flexors. You can cue them to make neutral. Now, my second student who already has a neutral spine in UTKATASANA, and if I cue him, tailbone tucked under or posterior pelvic tilt. In this case, he will flatten his spine. His shoulders would be rounded and he will have a constricted breathing pattern. Having the lumbar too straight can be just as bad as having it too curved. So friends, it is very important to know whether your student's pelvic is anteriorly tilted or posteriorly tilted, and accordingly you can cue them. Every student should explore knowing which muscles can activate an anterior or posterior tilt of the pelvis. He can experiment and find the pelvic position that creates the greatest ease in the lower back and the greatest sense of stability. And now let us talk about a posture known as KAKASAANA. KAKASAANA is also known as crow pose, and in this posture it is always recommended to do a posterior pelvic tilt. Now let us understand why we need to do a posterior pelvic tilt. So whenever you are doing a posterior pelvic tilt, what's happening? The core gets more strongly engaged. That means our rectus abdominis, our obliques and our transverse abdominis all gets engaged, and it is much better to do an arm balancing pose. So let us see how it is done. So I flex forward, I keep my hands on the block, right? I press it there, knees, and I strongly do that posterior pelvic tilt, and I engage my transverse abdominis, my rectus, and lift up straight, and I hold that position. And I lift up straight and I hold that position. My core is strongly engaged. And I come back slowly. Now in this position, the core is really engaged, and that's the reason you do a posterior pelvic tilt. Now if in question try to do a neutral or an anterior pelvic tilt, it would be difficult, and it might happen that you might have some strain on your back. So friends, KAKASAANA, posterior pelvic tilt. And now friends, let's talk about double leg raise, or in the yogic term is known as UTTANPADASANA. So let us see how posterior pelvic tilt will help lifting both the legs up. So I lie down in the supine position. Now if you see, it's a neutral spine because there is a gap in my lumbar spine. Now if I am lifting both the legs up, and if I try to do a neutral spine, it's difficult for me to lift up. Although I can lift up, but there's a lot of strain on my back. So what I do is I gently do a posterior pelvic tilt. So when I'm doing a posterior pelvic tilt, what's happening? My rectus abdominis, my obliques and my transverse abdominis all get active. Now as these muscles get active and I lift up, it's easier to lift up because my lower back is pressing the floor. The other option is, we say keep the hands behind the sacrum. So what happens when we keep the hands behind the sacrum? Automatically your pelvic goes into a posterior tilt. So I keep the hands behind and I lift up both the legs up. It's easier. Why? Because my pelvic is into a posterior tilt. So whenever you are doing a double leg raise, you are not doing a neutral pelvic. You are doing a posterior pelvic because you need to take the support of the core. Posterior pelvic tilt engages the core more strongly because your ASIS and your lower end of the rib cage is more near. Fine, core gets more stronger. So whenever you are doing a double leg raise, it's always recommended to do a posterior pelvic tilt. And in question, try to practice the same double leg lift with a neutral pelvic. Get your answer. So let us also check Virabhadrasana 1. Ideally, the spine should be in a neutral position in Virabhadrasana 1. The essential stretch here is not a backward bend, but rather increasing the flexibility of the quadriceps and psoas of the back leg while strengthening the front leg. Lifting the hips into a posterior tilt will ensure the muscles are lengthening and strengthening fully. And then the main work of the pose is to stretch the hip flexors and not push the rib cage out. Note that although the effort is of a strong posterior rotation, ideally the pelvis ends up in a neutral position. It has the sensation of posterior rotation due to strong resistance of the psoas and hip flexors. Virabhadrasana 1. Suppose you have a student who is anteriorly tilted. That means we talked about in the part 1, anteriorly tilted. Now suppose if you ask him to do a warrior 1 pose and he was already anteriorly tilted, and now when he lifts the arms up, the tilt is more. Now what is happening? The connection of the core is lost. The rib is thrusting out. If he does like this, there is more thrusting of the rib cage, there is more compression of the back, and there is nothing happening to the hip flexors and the quads. Now the main focus of Virabhadrasana 1 is strengthening the front leg and stretching the back leg, that is your hip flexors. And a Virabhadrasana 1 is very good to correct your anterior pelvic tilt. But if done wrongly, you can increase your anterior pelvic tilt more. So let us understand how. So that's my position. I would be, if you see, that's my anterior pelvic tilt. Now what I am trying to do is this. I'm strongly engaging the core, my hip flexors, the iliac and psoas, and my quads. So what I'm trying to do is tilt, use your core, use your strengthen of the hip flexors and the quads. Instead of doing an anterior, you are doing a strong posterior. Strong posterior. Lift the arms up. Neck and shoulders relax. My back leg, I can feel a lot of stretch on my quads. And the more I can go down, the stretch on my hip flexors increasing more strongly. And I can hold this position very comfortably. If I don't engage, that's what's happening. Right? So, as a yoga student or as a yoga teacher, it is important for you to know whether your student or whether you yourself, do you fall into an anterior pelvic tilt or posterior pelvic tilt. Friends, it's not bad. Even I have a little bit of gentle, more anterior pelvic tilt. That is not wrong or right. If you realize that you have an anterior pelvic tilt, correct your asanas in that way. If you are a person with posterior pelvic tilt, you need to keep your pelvic neutral. So at the end, we need our pelvic to be neutral instead of getting into an anterior pelvic tilt. And Virabhadrasana is a position that will correct your anterior pelvic tilt if you engage your core, your rectus abdominis, your obliques, your transverse abdominis, your hip flexors, the iliac and psoas, as well as your quads. So correct it by doing posterior pelvic tilt. That's your pose and not this. Hope it is clear with posterior pelvic tilt why we are doing a posterior pelvic tilt. Friends, here are some of the comments I would like to share with you. First of all, I would like to thank Mr. Kittuji as she has asked for how to get rid of anterior pelvic tilt, and she has requested for a set of asanas that will help her to correct the anterior pelvic tilt. Rajesh M, thank you for your appreciation. It means a lot, but Guru, I am not. I am still a student learning and exploring. And Mr. Kamal Sandhu, as also he has asked for asanas to correct anterior pelvic tilt. And Mr. J.R. Krishnan has been doing exercises for the last 6 months, but seems there is not any improvement happening. So Mr. Kittuji, Rajesh M, Kamal Sandhu and Mr. J.R. Krishnan, thank you all for your comments. Although I have mentioned one asana in this video, that is a low lunge, but in my next video I will be creating a yoga sequence that will help you to correct your anterior pelvic tilt. So please give me some time to create that wonderful yoga sequence for anterior pelvic tilt. Thank you for watching my video. Keep smiling. Take care. Namaste.